don't do them, great, it's new. You'll have this as some ammunition. I'll talk about the scalenes in just a second, but there's a stretch that we all do. Most of us do this, and we stretch like this, correct? We turn the head a little bit, and we stretch, right? Okay, most people do that. I want to tweak this just a little bit and have you all start maybe playing around with a little different technique. I do that, but here's what else I'll do. Okay, most patients lay down on the table and they lay down like this. By the way, anytime I lay someone on my treatment table, their feet are elevated on a wedge. Always, okay? Unless they can't tolerate that, which is rare. I make them comfortable, okay? Then, they usually lay down with their arms like this. The problem with this is, if they have a tight pec minor, okay, see that? I'm like a puppet master here. See that? It's tight. That's where the scapula should be, but it's not. I will bring your hands like this, and then when you stretch, you need to stretch with the scapula in a position that is more normal. It just makes sense, right? This is Sarah, right?
Yeah.
Okay. I'm going to stretch Sarah like this. Okay, she feels a stretch. Okay. Now I'm going to do that. I'm going to take that scapula down and then engage the tissue, and she'll tell you that feels different. Okay? So, as far as kind of this manual stretching business, just think about that. Think about the biomechanics. If you're stretching, I don't know if you should videotape this finger, right here, okay? This one. A lot of y'all, when I said here, feel this, if you noticed, I palpated with this finger, but you guys went in with that finger. What did I do? I said switch fingers. Okay, if you feel the tip of your index finger, there's a little callus on there. This is on mine. Okay, I'll show you on this side. But you're going to go not on the occiput, but just off of it into the meat. You got a little nastiness right there. Where those trigger points live. Semispinalis capitis, splenius capitis. Okay? And you're going to push on that. You're going to hook that. Look at what I'm doing here. I'm doing that. Okay? Then, push the scapula down where it should be. Take out the pec minor. And then deliver that stretch. Okay? Now, she's really sore up here. I think you told me you had a headache. Okay? So, go with what they can tolerate. Okay? I kind of went after it that first time. Now, I still have it there, but I flattened it out just a little bit. She still feels it.
Are you pretty much stretched on her neck?
Huh?
Are you going this way?
I'm going that way. Can you see that?
Yeah.
Because I like to stretch. I call this a functional. Got to get on the first rib. We're going to use this again, right here. Now, again, I could teach for 3 days on the neck. I could show you millions of techniques, but I'm only showing y'all a few that I do fairly consistently in the clinic. Okay? Some of y'all get on this first rib. It's going to be a little hard to see here. But anyway, you can't see the rib anyway. You just got to know where it lives. Okay? Clavicle. Okay? Spine of the scapula is back here. It lives in what we call this thoracic outlet, but not right in the thoracic outlet. You got to go, the scalenes are there, but the rib is in here. Okay, I'm on her rib with this. My thumb's in the way, right there. I'm on it. Okay. Now, sometimes it's hard to find. If you don't know if you're on it, push on something firm in there, and then have them take a deep breath. Take a deep breath. Oh yeah, there it is. It came right up into my hand. Okay, so sometimes you don't know if you're on it, but you get occasionally. Okay. But to stretch the scalenes now, you're going to get same position with that finger. Okay. Head in neutral. Push the rib down. It's a little uncomfortable through the upper trap. Sometimes you got to push the upper trap out of the way. Push the rib down. Now, can you appreciate, she might even feel a stretch already, just because I've pushed the rib inferiorly. it attaches to the first rib. The anterior middle scalene attached to the first rib. You have a picture of it, okay? It's in the book, if you don't believe me, okay? Then, I already have a stretch on the scalenes. Watch this, because you're not going to see much movement now when I engage this stretch. I'm going to slightly rotate. That's it. Feel that? It's a really, you didn't see a lot. You didn't see a lot. Look what I'm doing. I'm pulling. Turn and pull. Look at, if you ever want to know what direction I'm pulling in, you always look at my arms. My arms are always in plane. Always with what I'm doing. That way. Can you see this left arm? It's that way. She feels a good stretch there. If I let go of the rib, it's gone. That adds even more specificity. Push it down, stretch. She feels the stretch. And she's like, how could I get even worse than this? Then I will slowly rotate. And I'm going to stop about right there. And I'm going to let off. I'm going to give him some love.